The medical world has changed ever since COVID-19 hit and spread like wildfire across the globe. It hit the United States particularly hard, seeing as we have 6 million total cases and almost 200,000 deaths, with states like Florida, Georgia, Texas, and Illinois leading the way in an apparent epidemic race. Just like Smokey the Bear would say, only you can prevent wildfires. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases and figurehead leading America on coronavirus mitigation, would say,
I would like to see universal wearing of masks, and for those who want the extra kick to it, go ahead and either get a face shield or goggles.
The CDC and WHO websites have been my personal safe haven from coronavirus. I'm constantly fact-checking the stats and facts on the website and using it to guide how I'm functioning in everyday public. One of the most interesting things I've seen on the WHO website is the Mythbusters section, which sets the record straight on a lot of coronavirus misconceptions. Now here, straight from the website, quelling all your coronavirus worries. Fact: study shows that hydroxychloroquine does not have clinical benefits in treating COVID-19. Fact: spraying and introducing bleach or other disinfectants into your body will not protect you against COVID-19 and can be dangerous. Seems kind of obvious, but okay. Fact: most people who get COVID-19 recover from it. That makes me marginally less worried, but I'm still going to be vigilant about how I go outside and interact with people in everyday public. The CDC, unfortunately, does not have any Mythbusters to share, but they do have information available to us in a less fun and interesting way. They have the incubation period. The incubation period for COVID-19 is thought to extend 14 days with a median time of 4 to 5 days from exposure to symptoms onset. One study reported that 97.5% of persons infected with COVID-19 will develop symptoms will do so within 11.5 days of SARS-CoV-2 infection. Presentation. The signs and symptoms of COVID-19 present at onset illness vary, but over the course of the disease, most persons with COVID-19 will experience the following: fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and my personal least favorite, not that I've gotten the coronavirus, but just in sick in general, diarrhea. Scrolling all the way down the page show how hospitals handle COVID, and we see a lot of technical information and vocabulary probably meant for hospital staff and doctors. Viral testing. Diagnosis of COVID-19 requires detection of SARS-CoV-2 RNA by reverse transcription polymerase chain reaction, RT-PCR. Now that was a handful of words that I have never said before. Mild to moderate disease. Patient with a mild clinical presentation, absence of viral pneumonia and hypoxia may not initially require hospitalization, and many patients will be able to manage their illness at home. The decision to monitor a patient in the inpatient or outpatient setting should be made on a case-to-case basis. Severe disease. Some patients with COVID-19 will have severe disease requiring hospitalization for management. Inpatient management revolves around the supportive management of the most common complications of severe COVID-19 pneumonia, hypoxemic respiratory failure ARDS, sepsis and septic shock, cardiomyopathy and arrhythmia, acute kidney injury, and complications from prolonged hospitalization, including secondary bacterial infections, thromboembolism, gastrointestinal bleeding, and critical illness polyneuropathy and myopathy. Despite most people recovering, like the WHO said, when the virus gets severe, it gets severe. Now, a lot of people don't like to wear their masks outside. You can tell by all the videos on social media of people just getting so angry that they can't wear their mask. But, like Dr. Fauci said, wearing masks will most likely help, and most places require masks now. So, that's one thing that we can do to, help everyone around us. And now that we know all this information is available online, just don't take my word for it. Don't let a random college student like me tell you what's fact and what's fiction, Find out for yourself. Staying connected is more important now than ever. Do your part. Like Smokey the Bear says. Peace out.